Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. My name is Mindy Bennett, and I am the Interim Deputy Chief of Partnerships at Child Care Aware of America. I wanted to welcome you all today to our Mapping the Need for Childcare for Essential Workers during the coronavirus outbreak. Child Care Aware of America is thrilled to have partnered with Yale professors Walter Gilliam and Eli Fenichel and their colleagues to promote and disseminate a new interactive map that estimates the childcare needs of essential workers during the COVID-19 pandemic. Today, we will have a conversation to begin with. If you have any questions whatsoever, please put those questions in the question box on your tool. On your tools next to your slides. Once we are done listening to our presenters, we will have a question and answer period. We'll try to get to all of your questions. If you happen to have a question that we don't answer, please know that we'll send out additional answers to questions in our follow-up material. Today we have with us Dr. Walter Gilliam, who's the director of the Edward Zigler Center in Child Development and Social Policy and professor of child psychology at the Child Study Center at Yale School of Medicine. Additionally, he serves as the president of our board of directors on the Child Care Aware of America board. We also have with us Dr. Eli Fenichel from the Knobloch family. He is the Knobloch Family Chair of National Resources Economics at Yale University. Joining us this morning is also our Dr. Lynette Fraga. She is the Executive Director of Child Care Aware of America. She joined us in 2012, and since that time she has sought to position Child Care Aware of America as the nation's leading voice on child care in policy, practice, and research. As an authority on child development, Dr. Fraga serves in an advisory capacity on a number of research pieces on national panels and committees, in addition to being on the board of directors for Generation United, All Our Kin, and Let's Grow Kids. Dr. Fraga began her career in early childhood as a teacher in infant, toddler, and preschool classrooms, and has since held positions at the local, state, and national level within the nonprofit, corporate, and higher education sectors. We're going to start this morning by turning the reins over to Dr. Fraga.
Thank you, Mindy, and welcome everyone. Good morning. Thank you so much for joining us to learn more about an important new tool emerging from our partners at Yale University in response to the coronavirus pandemic. This crisis has demonstrated just how important our work is. From the child care resource and referral agencies that help parents find child care, to the child care providers who are enabling healthcare workers, first responders, and so many others who provide essential services to stay on the job, even as providers are facing their very own difficult decisions about whether to stay open. Child care resource and referral agencies and child care providers across the country are looking for information and resources to help to deal with the challenges posed by the coronavirus. Policymakers and those responsible for child care planning in our states and communities are desperately seeking answers and want up-to-date data and research to support them in making critical decisions for their communities and states. Child Care Aware of America has compiled all the latest resources and maps related to this emerging child care crisis, all in one central place. So you can find that at childcareaware.org. For some information about what our website includes. First, a state-by-state map with frequently updated information about coronavirus and childcare in each state, including closures. We recognize that this is certainly, if not a daily change of information, almost an hourly change of information, and our team is working really hard to make sure that that information is up to date. A flow chart that includes questions to help childcare programs determine whether to stay open or close in response to the coronavirus pandemic in their particular community, in their particular city, in their particular state. A resource hub with coronavirus resources for childcare providers, CCRNRs, and families and policymakers from Child Care Aware of America, federal and state agencies, and other trusted resources. So we have a Share Your Story page, so you can let us know how this pandemic is impacting you and your providers in your area. We are sharing these stories with policymakers, importantly, to advocate for more assistance to help providers weather this crisis. A Legislative Action Center is also located here to contact members of Congress to urge them to support childcare in their coronavirus response. Providers of care are necessary and needed during this time, and we need to have Congress behind us. And the latest addition to our website is the subject of this webinar, an interactive map of childcare needs for essential workers during the coronavirus outbreak. So now I'd like to introduce you to Dr. Walter Gilliam. Walter Gilliam is the Elizabeth Mears and Howes Jameson Professor of Child Psychiatry and Psychology at the Yale University Child Study Center and Director of the Edward Zigler Center in Child Development and Social Policy. Dr. Gilliam is the current president of Child Care Aware of America, a board director of several other national early childhood organizations, such as 0 to 3, the Irving Harris Foundation, First Children's Finance, and All Our Kin, and a former senior advisor to NAEYC. He is frequently quoted in major national and international news outlets and actively provides consultation and invited testimony to decision makers in the US and other countries. He was co-recipient of the prestigious 2008 Gromeyer Award in Education for the co-authored book, A Vision for Universal Preschool Education. And with that, Walter.
Thank you, Lynette. Hello, friends. Well, obviously, this is a very challenging time for many of us. And one of the things about challenging times is that challenging times are often also revealing times. They oftentimes can tell us a lot about ourselves, about how we rise or fall to challenges, and what it is that we hold dear and who it is that we care most about. In this particular challenge, the first thoughts that I had were to the people who are serving us, the essential care workers who are making sure that our foods are stocked on our pantry shelves, the people who are making sure that the deliveries of essential equipment are being made, and especially those who are first responders and those who are working in hospital settings and medical clinics, the doctors, the ICU nurses, the other important essential people who work in these hospital and medical settings, who keep the spaces clean and sanitized in between patients, who make sure that the food is ready and served so that the doctors can keep working and the nurses can keep working. The people who move patients, who move records, who move equipment around. In many cases and in many ways, a hospital CEO is more like a mayor who's really running a small town of people dedicated to keeping us safe. And when we go to the doctor's office and when we go to the hospital, especially in a time like this of a pandemic, the concern we might have would be will we be met by a doctor or a nurse who's concerned about whether they have the right equipment available to be able to help us, to be able to take care of our needs? Will they have the right protective equipment available for them, personal protective equipment available for them to keep them safe? And we might not be able to do much about that in the child care industry, but the worry that I would have is as they're worrying about all of those things, what can we do to make sure that they're also not worrying about who's taking care of their own children? As these brave men and women who work in the healthcare industry are working to try to save us and to be able to help us be able to be healthy and well, the very least that we can do, I think, is to make sure that they don't have their minds burdened at the same time, worrying about whether somebody's taking care of their own children at home. I know that here at Yale New Haven Hospital and I know many stories that I've been hearing, and some of the stories that I've been hearing are about doctors who are working in the hospital, because the hospitals were already close to capacity anyway, and the surge hasn't even happened yet. And so many of these doctors were now without childcare because the schools had closed, childcare programs had closed in order to be able to control the pandemic. And as these programs had closed, they have their 2-year-old child, 3-year-old, 5-year-old child, 8, 9-year-old child at home. and they're not sure who's going to take care of this child. But this ICU doctor, this nurse needs to be here in the hospital in order to be able to take care of us. And so what do they do? And in many stories that I'm hearing, they're turning to a lot of things. The doctors are going to the hospital and getting ready to take care of us, and then they work a long shift, maybe 10 hours, 12 hours. They go home, and when they go home with one of their coworkers' child, and takes care of that child for the next 8, 9, 10 hours while they're at home, while their coworker works, and then they switch off childcare assignments. You know, that's not a good way to run a hospital. And what is it that we can do in the childcare industry to be able to help relieve some of that stress from them? That's when we started trying to figure out exactly what the level of need is, how much childcare would be needed in order to be able to take care of these children who are the children of those who are taking care of us. And we started trying to conduct some of this information from surveys of hospitals, and it certainly proved challenging to be able to get this information back quickly in the middle of a crisis that they were already dealing with. And then by happenstance, I ran across Eli Fenichel, who just oddly enough works about a block and a half away from me, but in a way that's very emblematic of how universities can sometimes be. I've never met him. But he was just a few buildings away, and Eli Fenichel is an expert in resource management and had access to an incredibly large database that can shed an awful lot of light on who it is that works in hospitals and who else is available in their home that could take care of their children and how many children would need to be taken care of. And so what happened was we shifted gears very quickly, and over a 3-day period where I don't think that Emily nor his colleague Jude, Eli or his colleague Jude, slept very much, they cranked out an incredible tool that's able to allow us to be able to estimate the amount of childcare needed in various different metro areas across the United States and in states. And so with this tool, what we're hoping to do is to be able to get a better sense of the need. But then after we get a sense of the need, then we're still going to have to figure out where the capacity is going to be. And we have to figure out where our leadership is in terms of making sure that the resources flow from the federal level to the state levels in order to be able to provide this childcare and to do it immediately and quickly and to do it safely. We need to find the space. We need to find the staffing. We need to find the supplies like disinfectants and diapers and be able to make sure that those are delivered in the time that they're needed to be delivered. We need to be able to make sure that the supports are there, healthcare supports to keep these environments safe in the middle of a pandemic, because bear in mind, we're talking about emergency childcare programs for children who are the children of people who are working in healthcare industries. And so these children are going to be at a risk already. And so how do we provide the necessary healthcare within these childcare settings quickly in order to be able to keep them safe? And how do we provide the safety protocols in order to make this as safe of an environment as possible for the children in it, as well as for those staff that are taking care of it? So if you are, or if you know someone who works in the healthcare industry, a brave doctor, nurse, or other individual who works in these industries in order to keep us safe, thank you. And if you are somebody who works in the early care and education industry, or somebody who cares for children, or cares for those who care for children, then thank you too for what you do. I would imagine that that would be the only reason that you'd be on a webinar like that today. And so thank you for being here. And with that, I'm going to turn this over to my close colleague that I met only virtually about 5 days ago, Dr. Fenichel. Thank you.
Hello, everyone. As Walter said, a month ago, all I knew about early child care was what I've learned as the parent of a 4.5-year-old. However, for over 10 years, I've been working on the economics of social distancing. It sort of tailed off about 5 or 6 years ago when people weren't so interested in the topic. Our early work had been on the swine flu epidemic that was about a little over 10 years ago. And my colleague Jude and I had been working on what happens to the kids, when you close schools. And we have a paper that sort of looks at the labor force implications of that. And in that paper, there was a footnote that said something: we really want to be worried about healthcare worker kids. Where do they go? Because most epidemiological models just kind of drop them out of the model or assume they can stay home by themselves. So we have a working paper that's in review now where we try and understand what the potential labor force implications are for healthcare workers if they have to stay home with their kids. And just to sort of put some numbers on this for you before we talk about the dashboard itself, just under 30% of our healthcare labor force is registered nurses. Just under 20% are nursing home health aides. This group is very important because they're providing infection control in nursing homes and for elderly vulnerable populations. So these are huge segments, and at least stereotypically and in the data, they're disproportionately women who may be the ones who are being sort of burdened with childcare disproportionately. The other thing is nurse practitioners, physicians, aides. Over 20% of these people don't have another non-working adult or older child in their household that could help out with childcare. So, and these are really important groups. Diagnostic technicians, we need people who can do testing. 19% nationally. Now these numbers vary state to state fairly widely, and they're available on a website that we've put up a sort of state level breakdowns. So we had this paper circulating, and Walter said, well, could you count the number of kids? And so that's what we did. Our data come from a US government survey called the Current Population Survey that's run by the Census Bureau with the Bureau of Labor Statistics. It's a monthly survey. The data we're using come for the state level aggregates go back their averages between 2017 and for the dashboard February 2020. When we break down to metro areas, we have to go back a little bit further to get enough observations to populate it to get averages. So these are coming from basically workforce participation surveys where we know something about the household structure and we know what industry and occupation people are working in. For the dashboard right now, we've just focused on industries. So here you can see the dashboard, and you can see here this is the employment sector. For industry, we have it defaulting now to all industries. It's on all industries right now. So what this is basically telling us, if all here is just number of kids, you can read that as number of kids, not really other child care provider. And these are for kids, we've highlighted, you can use control to select different buttons here, 0 to 11. There's about 46 million kids in working households in the US, which is about right if you compare it. Most of the aggregate numbers are for under 18. And so this is about 2/3 of that number, which probably seems about right. We can select here and just focus on healthcare industries. And we'll see, we see this map right here. This is, I can't quite get Alaska and Hawaii on here. Sorry, folks. So this is a map that sort of is showing relative number of kids in the healthcare industries for all states. We can look at these industry classes we've broken out. There's all healthcare industries. So this is basically anyone that's flagged as a healthcare industry. All industries is any working industry. Essential industries, if you come down, let's see if I can scroll down on this. Having a bit of trouble here. There's a lot of documentation down here, and there's a web link. Whoa. For how we classified other essential industries. We're working to refine that to make it interact with occupation. But this is really broad. Essential industries includes everything from material handlers, people loading soap onto trucks, to doctors, to first responders. So it's really broad right now. So it's that might not be. I don't know how useful that is yet, but it gives us some indication of what's in between. We can look at specifically hospitals. So these are all hospital workers. As Walter pointed out, these are people who are indicating that they work basically in the hospital industry. So this includes our doctors and nurses. It includes our hospital administrators. It includes janitors. It includes food staff. But it also includes people doing billing, procurement. Some of these jobs can be moved off-site. However, they're probably still really important to have the person whose job it is to find masks for doctors working. And like I said, I have a 4.5-year-old, so at least personal experience tells me it's really hard to get work done when she's climbing in my lap. So we also have said, well, we can go a little bit broader because there's a lot of people who are in maybe outpatient facilities, doctor's offices, urgent care centers, who are now dealing, now maybe working in hospitals or dealing with COVID-19 cases, or all the people who don't have COVID-19 cases who are still getting sick and still have underlying health conditions that need treating. So that gives us that selection. And then we can look at nursing and care facilities. So these are nursing and non-care facilities, and this is giving us national numbers. This set is telling us healthcare providers. And so these are tiered healthcare providers. So these are tier 1 is indicated here as preschool, kindergarten, elementary, middle, special education teachers, and child care workers. And so my understanding, so Walter worked really closely with us on developing these tiers. These are the people who are already licensed. These are people who are reporting that they were working in this industry. And then we have secondary tiers. These would be education administrators, secondary teachers, teaching assistants, and other teachers. And we've broken these out into 3 age groups because one of the things we might want to be worried about is calling up too many over 60 childcare providers right now, given that they are also at high risk. So we can actually see this by age category. I'm going to go just toggle this back to, let's just look at hospital and outpatient for salience here. So then we can look at, we've been just looking at the number of kids here with this number. But there's a lot of households that have another non-working adult. So we can basically eliminate the kids who can be provided because they have another non-working adult in the household. Now we need to be a little bit careful with this number because non-working adult, this could be a stay-at-home parent. It could be somebody who's unemployed. It could be an older child who's in their 20s or something who happens to be living in the house who's unemployed. It could also be an elderly grandparent who's not able to take care of him or herself, and they might not actually be able to provide that child care. We're going to work to refine those numbers. We've just got a lot of fires we're trying to put out, like all of you. So this was a first cut. We can also ask what about households that do have older siblings? These are 13 to 20-year-olds living at home. And we can see that this number is going down nationally here. We can then drill down, we can come down, and we can do this one of 2 ways. We can click on a map. Let's look at California. We can just click on California, and we'll see that the numbers change, and we're getting new estimates for providers and new estimates for children. We can click anywhere else on the map, and that's supposed to go back. There it goes, and it goes back. We can also do that. Sorry, there's a bit of a lag as I control this over the web, so bear with me. We can also come in and look at a specific state, and I'm in Connecticut, so we're going to look at Connecticut now. And right now, the map is just going to show the centroid of the state. That's the middle of the state. We're working to get maps of geography, of more resolved geographies. So this is now giving us our number. We've got hospital and outpatient children. I might get rid of this thing. There we go. Hospital and outpatient children, 16,000 in Connecticut. After we account for the fact that maybe there's an older sibling or non-working adult that's going to pick up some of that child care demand. We're going to work to see if we can get numbers for people with absolutely no other in-house potential providers. We do have sort of numbers of single-parent households already, and so we're going to work to integrate those over, in probably the next week or so into this dashboard, which would give us sort of the lower bound. So these are probably somewhat upper bounded numbers. We can come into geographies now. And these are the way that census does statistical sampling. So it's not exactly just New Haven and Milford, but it's sort of that statistical unit. So I can click on that, which is where I'm at. And we can see that we have 5,000 children that for hospital and outpatient workers that probably need some child care. We can then break that apart and we could look at just, say, infants, which might be particularly challenging. We're looking at just under 1,000. 3 to 5s, just under 1,300, and then 6 to 11s, a little over 2,700. And then we can use the control key to bring all these back in. We can come back here, and there's this little eraser that pops up, and this is actually the easiest way to clear selections. And there should be one up here. And then we need to go back here to all if we want to unselect all. So what all is telling us is all is telling us the numbers for the entire state. Now I said these are sampling areas. And so what that means is when you look at this geography where there's cities and towns listed, if you select all of those, they're not going to sum up to the state. This is going to be particularly true for people living in rural states because this is a government survey and it's really important, and it's public use data that we're pulling from. And so because we know household structure, in occupation, age, and a bunch of personal information, in rural areas, you could start identifying people. So the government anonymizes that and just pools states together. So our state aggregates include the rural areas. The metro statistical areas do not. That's why those won't sum up to the overall state. The other thing to know is that this is a survey, and it is possible that as we drill down to finer and finer categories, say a state, a geography, hospital, this group here, this sort of, critical need work, where there's not another person who could provide the childcare in the household, and then maybe 0 to 2s, it's possible this number will be 0. It does not mean that we believe that there are 0 children there needing care. What it means is that there are not enough people in the survey falling into that category to provide an estimate. My suggestion would be to try and find a similar area, an area that you think is similar, and use their estimates if you're getting 0s. And that's sort of a statistical sampling error that we can't do any better on. Let me see, I have some notes here. I want to make sure I covered everything that's sort of come up already. Yeah, and I can't be thankful enough to my collaborators here, Jude Bam at Colorado State University, who's done a lot of the data munging, along with Sam Maurer at EcoHealth Alliance, and my wife, Tonka, who's really the data visualization guru in the household, who's been looking over my shoulder as we put this together, and helping put this together. So, and then Walter's been great, sort of prodding us along. We would have never thought to do this had Walter not reached out to us. And so we're just really happy to be helpful right now. So I can take any questions, I guess, about the dashboard now. Is that the plan? Can't remember.
Yes, absolutely. Thanks, Eli. We do have one question that has come up while you were talking, and if anyone else has questions, please chat them into the question box, and we'll make sure to get them asked. The first one that we have is an individual who wanted to know if you could explain a little bit more about the non-working adult and household category and how you are accounting for the current situation where many folks have been laid off or are working at home and therefore don't need or don't want or don't need out-of-home care.
Yeah, no, that's a great question, and it's an issue because the world is evolving so quickly. We started doing this 2-3 weeks ago. We still thought it might be we were still worried people were going to think it was insane that we were talking about complete school closures. So a parent or an adult here is actually not a biological parent. It's basically any adult in the household. They can be non-married, same-sex, alternative sex, biological foster parent. It's any adult. Non-working adult is somebody who, again, up through February 2020, was reporting that they were unemployed or they were non-working. So if there's economists, these are people not working. This doesn't mean that they're unemployed, which means that they're looking for work. These could be stay-at-home parents. These could be elderly grandparents. They could be people who are employed. What we're going to work to do, what we've realized we need to work to do is address this, is basically figure out, is there another potential provider at home once we basically say the person with a job that's not in this industry could provide care. This gets really tricky. We know, we ran some numbers, about 0.5% nationally of healthcare workers, if they have another adult in the household, that other adult is also in the healthcare industry. And so what's gotten a bit tricky and why this has been slowed up is we're trying to figure out what adults to count and what adults not to count. Because just because somebody's not in the healthcare industry doesn't mean they're not an essential worker. So you could have a doctor, right, and she could be married to a police officer. And so that doesn't get us, and so the police officer won't show up in the hospital industry. So we haven't really figured out how to, we're working to sort of create some tractable filters so things don't just explode and sort of data. You know, one of the problems is we actually have this really beautiful, rich data set. The problem is not that we don't have data, or the problem is not that we don't have information. The problem is turning information into data that's actionable and useful for you all, and providing useful filters. So we're going to work to basically get a lower bound, which basically says anybody not in the sector that you've selected on might be able to provide childcare. But again, that'll probably be an underestimate, given that there can be a lot of essential workers who are able to work from home, but might not be able to work from home. Certainly, I don't get anything done when my daughter decides that she needs to look at My Little Pony on my computer.
Great. Thanks so much, Eli. If anyone else has any questions, please be sure to chat them in the question box. Right now, we did just have another one come up. They want to know, is it possible to further filter the tiers? Example, only for childcare workers?
Only for the tiers. Oh, I just need some clarification. So these are only childcare workers. If they're talking about these tiers, but I got another request this morning that could I split out preschool workers? Yeah, we can do that, so we can split those out by actual. So these descriptions of the categories are the level at which occupation is reported in the current population survey. So we can split down to occupation within tier. What I can probably do, if this is helpful for people, is over the next couple of days produce a link on the dashboard to a filterable Excel sheet where you'd be able to filter through those. I'm not 100% sure that we'll be able to integrate it to the sort of fancy dashboard, largely because of space on the dashboard, and I'm trying to think about the best way to do that. We'd have to think about if we can get it filterable on the dashboard, but it's on our list of things to do since we've already had a request to do that this morning.
Great. And what about splitting the federal programs and state programs versus private? Is that a thought?
Can you explain that a little bit more? A little bit more to me. Is this about the funding source for the?
That's what it would be. Yes.
So
yes, I believe that's what the question is.
I don't think we'll be able to do that. I will have to check, but I'm almost certain we can't, because this is not a survey of childcare centers. This is a survey of American households. And what they're doing is they're asking people, what industry do you work in, and what's your occupation? And so I mean, I don't know. I can imagine situations where people are being asked this and they might not actually be 100% clear themselves if the school they work at is, you know, federally funded or locally funded or private. I mean, I guess most people probably do know that, but that's not a question that's asked. Part of the reason is, I think one of the main reasons the government runs this survey is to sort of get a handle on unemployment. But I can check, but I doubt it.
Great, thanks, Eli.
I would agree with that too. I don't think the data allowed that. And regarding the earlier question having to do with the tier 1 and the tier 2s, it certainly would be lovely if it were possible to be able to have clickable buttons to be able to select exactly which type of title you're looking at. But as Eli said, I don't know if there's going to be enough. He doesn't think there might be enough room on the dashboard to be able to put all of that. And two, Eli and Jude and their other colleagues cranked this out literally in like 3 days of non-sleep. So I think those are the two considerations. But I think the data would allow it. I just don't know if
Yeah, no, the data certainly allow it. That's not an issue to break these out further. The more critical issue, I mean, it's sort of a techie issue, which is if we put up a dashboard with 500 numbers on it, it's not helpful, right? It gets to be too much. That's sort of the beauty of the dashboard, is it allows you to drill down. There are some immediate issues in us being able to produce these quickly that create some aggregation. We need to be careful about the way things are aggregated so there's not double counting. But we'll try and get something up that's at least a link to a Excel sheet where you can click on a filter there and find your region and find out how many preschool teachers you have, or how many kindergarten teachers you have, or how many elementary. I think elementary separate. Walter, you looked at this code yesterday or 2 days ago.
Yeah, for the most part, the titles that are there are the codes, and we just put them into 2 different tiers. What we could perhaps do is to create, and boy, this is the most unusual training webinar on how to use a tool, because you're listening to a training webinar on how to use a tool as the developers are redeveloping it. But Eli, what about putting 3 tiers? And tier 1, because if I'm understanding the question before correctly, the question before is that they want to be able to know, what about people who specifically really do work in the childcare industry? And those people are mostly going to identify as childcare workers, and some of them might identify as preschool teachers. And so we could put tier 1 being childcare workers and preschool teachers, and then tier 2 be the remainder of the current tier 1, and then push tier 2 down to
yeah, it's a real estate problem to have all of those numbers at once.
Got it.
Right.
When Eli's saying real estate, he means space on the
to get it. Anyway, I don't think this is the best use of time right now. I think that I would like to collect some more questions, and we can sort of think about ways to actually get the communication and design done.
Sure. So then another question that we have is a question wanting to know if family child care and the infant toddler care population is included in that preschool teacher tier.
Can somebody help me out here with what family child care means? Because I was Googling it and saw some different definitions.
Absolutely. So the family child care would be care that is defined by the state, that is done in someone's home for children. So it's not like a nanny type care, it's care that's done in an individual's home.
Oh, okay. So this is like the house I live in. I live in a house that for years was owned by somebody named Mama Flood, who ran a child care, and my mailman and our UPS person and our neighbor all go, I went to daycare in your house. So that's what you're talking about then?
Yes.
Okay. Probably, because those people presumably, if they were surveyed, would respond that their occupation is child care worker. So presumably they would be there. If they're doing this completely under the table and they don't want the government to know, they might not respond that way, right? But I think if they were, I know that when we bought our house and we looked at the permits, they were like, your child care facility permit has expired like 40 years ago. Do you need to renew it? I'm like, no. And so, but like those sorts of things where people are doing this legitimately, you guys would know better, but if you got a survey and somebody who's doing this, they responded that yes, I am a child care worker, or I own or run a small preschool, then they will be in the tier 1.
Great, thanks, Eli. I think this next question is for Walter and Lynette. The question is, do you have any recommendations on how this tool could best be used at the state level for advocacy to better target any type of resources or get support from the state?
Lynette, would you like to jump into that?
Sure, and I'm going to ask all of us to jump onto camera now. Eli, we're going to surround you, Walter and I, and your wonderful data work and the information you've provided thus far. So I will start, Walter, and please jump in, because as Eli was sharing, there are innumerable number of questions and ways we can think about the data now as it sits. As well as ways that we can potentially continue to collect data and analyze that data. I think the number one way that we can be thinking about this tool and utilizing the data and the information as point of advocacy is really about demonstrating the need. When I think it's the loudest, I think, message when you look at this tool for the first time is the number of children that need care that are in the health industry, and mapping that against the closures in your area and seeing the gap that lives there. And the advocacy messages can be and need to be everything from we have a great need for individuals who are in the healthcare industry to be available, and we so appreciate their work, as was articulated by Walter earlier, and their support of us from a public health and a health perspective, and they need their children to be cared for by us. How do we meet that demand, the need that is clearly demonstrated in the maps here, even as we may be able to stratify the data by age, for example, which I think is critically important for planners, for example. If there is an inordinate amount of a very high amount of infant need, for example, that space and place that's being chosen in order to provide care for children of essential workers who have infants will look very different than school agers, for example. So how much school age care do you need versus infant care? From an advocacy perspective and from a planning perspective, this is information that you can then relay to decision makers, both policymakers and planners who are trying to respond to this pandemic. That's just one way of thinking about utilizing this as an advocacy tool. I think another way is the discussion that's happening right now about not only the increase in need of supply, but also, frankly, the need generally for childcare. Before we reached this pandemic stage, we certainly had a struggling investment in childcare. What we see now is the criticality of childcare and the infrastructure of work life, and that will continue that need will continue. And who out there is providing that care and being able to make sure that we continue to advocate for those early childhood educators that are also walking hand in hand in the front line with our medical professionals and our healthcare professionals. So those are some ideas, and Walter, you may have some additional to add.
Yeah, thank you, Lynette. I think, in addition to figuring out what the need is nationally, what the need is within states, when you click on the geography toggle down, you can then be able to see how it might proportion out within your state in different metro areas. What's going to be harder to estimate from this is the rural need. Because you can't pull that out separate. And so one of the lessons from this is, as is often the case, our rural families go forgotten, and we just aren't able to put them in here. But we should remain cognizant of that. The other important feature too to think about in terms of like how to think about this for planning regarding the advocacy issue is when you look at the other child care provider in the home and you click on all, that gives you a sense of the number of children within that work sector that needs care. But then when you click on the non-working adult or other sibling, that's filtering out all those families that someone else in the home could potentially step in. It wouldn't be ideal, and it might not be ideal for a 16-year-old sibling to be caring for their child, for their siblings in the home, but it would be possible in a terrible pinch. And when you see what that number is and how big that number is, even after you factor out other family members who might be able to provide this care in a pinch, the numbers are still pretty high. And so those numbers then represent people who absolutely would need to have childcare in order to be able to come in reliably. The need here is pretty significant.
Walter, I'm just going to throw another number in here for people from some of our other research. When we look at the nursing home healthcare aid industry, again, these are people providing, these are probably the frontline people providing infection control for seniors. Almost 15% of those households are single parent. Right, so these are people who are probably struggling with childcare to begin with, and now we're asking them to protect highly vulnerable elderly populations.
Yeah, and I'll go you one farther too that we can't put in this dashboard because I don't think that the data exists within the current population surveys. Is that when I did a survey with some colleagues at a large, I'm trying to figure out how best to say this, at a large hospital system in a northeastern state, because I've not been given clearance to identify which one it is. You might be able to make your guesses. When we surveyed them to find out exactly what the need is, about 55% of the staff work days only. The other 45% work a combination of days and evenings and nights. And so if you want to talk about keeping a hospital up and running, we're probably not just talking about typical hour childcare. We're talking about typical hour childcare in second shift and third shift. And for doctors and nurses, they sometimes don't work your typical 8-hour shifts at all. They work much longer shifts. And so trying to figure out how to best provide that in a way that allows them to go to work and in a way that's as safe as possible will be a challenge too, that we can't adequately represent in the data that you have in front of you.
I think the other thing to keep in mind as well is that doctors and childcare workers are going to wind up contracting COVID-19 during this epidemic. So yes, at some point, the capacity is going to get strained all around. But I mean, you all are as big a heroes as the doctors on the front lines. The system doesn't work if one part falls out.
Yeah, agree. And then the heroes behind those heroes are going to be these people taking care of their children, which then brings us back to looking at those tier 1 care providers and tier 2 care providers. One of the reasons why we have them in those tiers is because if we flatten the curve, in the process of flattening the curve, you're also elongating the curve. And if this lasts for a long enough period of time, like Eli said, doctors and nurses may become ill, childcare providers may become ill. And we might not be able to only rely on people who are licensed to be childcare providers. We may have to dip deeper into the pool of other professionals who have been licensed to care for children, who have been licensed to care for children, who have been fingerprinted, who have had background checks. And that includes people like public school teachers, elementary, middle school, special ed teachers.
I think this goes into another question that we received. They think the answer is probably no, but they were wondering if we have any estimates about the unofficial care arrangements, such as nannies or family, friend, and neighbor care, and how many of those folks might have care that we've thought of.
Let me check. I'm not going to go take the next question if it happens before Walter or Lynette, and I will see if I can quickly get an answer to that.
Thanks, Eli. Is there another question, Mindy?
There's a question on what are our plans on how we think we'll use this data in some parts of the country right now. They're not hearing that there's a huge demand for childcare because families are trying to find other family members to care for their children during this epidemic.
So I would just first respond that it really is dependent right now, and this is anecdotal, on the area that you're in and the industry that you're in terms of demand for childcare. We've actually heard significant demand for childcare, particularly for essential workers, and trying to identify where that care may be. So I think the driving force really is what's occurring within communities and the available resources, personal and family, that are able to support individuals identifying care situations. So, and to the point that both Eli and Walter raised earlier, we're in the midst of in somewhat predictable, a lot of unpredictable space about the length of time that we may be in this experience, and trying to be as responsive as possible to what we see happening in our communities from a care perspective. So I think it was Eli who mentioned that a few weeks ago, the idea of all states closing down schools for the balance of the school year would not have been in the conversation, but now it is. And so the implications of that is pretty intense. And also obviously creates a demand for support and care. It's also, you know, to Walter's point, the amount of time that this may take for us to get through this experience, and the impact and effect that it may have on childcare providers as well as individual healthcare workers will also lead us to understand better the care need. So we're really trying to do two things at one time. One is to try and see a little bit around the corner so that we can anticipate where the need might be, and resources such as this really helps planners in doing that, and making sure from an advocacy perspective that child care resource and referral agencies and others, other planners have the data that they need in order to plan for the care that may be on the horizon. But this is not equitable right now across the country. Various states are experiencing this at different phases and have different levels of intensity. And so we as a national organization have to be responsive to those, to both the national picture as well as the local and state needs and what we're seeing play itself out. And also utilizing those affected earlier, like a Washington State and a California and a New York, and what that might imply for a Connecticut, a Georgia, a Louisiana, where we're starting to see more impact. So I think that everyone's going to be at a different place in the experience, and the extent to which we can learn from that is going to be really important. Walter, did you have any thoughts about that?
Yeah, I again, from the hospital that I cannot identify, I'm hearing we need help right now. We need help right now. We need childcare right now. The doctors, the nurses, they don't know who's going to be taking care of their children. They're not sure if they're going to be able to come into work. And they were already near capacity before COVID-19 came in because of seasonal flu and other types of things. And so this is going to take them over capacity very quick, you know. And so there's certainly a huge need. But I would be remiss if I didn't point out the fact that there are organizations that are doing their absolute best to step up. There's YMCA programs and a wide variety of communities that have offered to utilize their licensed space in order to be able to provide childcare, both in terms of early childhood as well as school-age childcare. I heard not too long, I think it was KinderCare, is that right, Lynette? That was talking about over 400 centers, Bright Horizon programs. And so then the question then becomes, will that be enough? And I think that what we can tell from the data that we have right here is that, you know, as wonderful as it is that organizations like this are stepping up and taking the place of government response, that it will not be enough. and that we need something beyond just altruism of individual organizations that are stepping up and doing the right thing. We need a more systemic government response in order to be able to make sure that these childcare programs are opened, but opened in a responsible way to be able to safely care for those children and to safely care for the staff that are caring for them.
So I'm gonna come back. I'm gonna comment on what Walter just said, and then I'll answer the question. And I have mixed news on the answer for the question. So I think it's really important to keep in mind that we also can't wait for the government response. And I think partnerships like these are super important for innovation, because I do feel like all my work on economic epidemiology suggests that we're gonna have to innovate our way out of this as much as finding cures. And I mean, that's the end game, not waiting for the government to tell us what to do. On the, can we say anything about in-house childcare? So if there's a live-in childcare provider, they might be reported in the household. They might be being counted as a parent, the way we've summarized the data. So if you have a live-in nanny, that might already be considered another, although they might show up as another working adult. So we'll have to double check. I'm not 100% sure. I think that's the problem with that too, is it's just, my guess is it's such a small sliver of the population that has a live-in nanny that we're probably not going to get a whole lot of traction there. There is another survey that we work with that's not where we're pulling, it's a subset of the current population survey. It's called the American Time Use Survey. And what this does is it asks a stratified random sample of the current population survey respondents to keep a minute-by-minute daily diary of their activities. And we've been using those, that's been running since January 1st, 2003. We've been using those in some of our other economic epidemiology work. One of the activity codes in that survey is providing childcare for someone else's child. And then you have a location. And I think one of the locations is other house. So in theory, we could figure out how many people are, we could sort of come up with some crude estimates of how many people were engaging in babysitting. Those data are only released annually. I believe the most recent are actually the 2018 data. I'm not 100% sure if the 2019 data have been released yet. I have a hard time believing, though, that that's going to be super actionable for two reasons. One is that survey surveys people 14 and up, I think 14 or 15 and up. So some of that could be people who are doing babysitting that are now no longer willing to do babysitting because they're self-distancing themselves. Also, you know, the amount of who's providing childcare now probably looks substantially, you know, that kind of childcare probably looks substantially different than the way it looked even a month ago. So I'm not sure how actionable those numbers are. So what I would kind of request from your community is to sort of let me know how big of a priority it would actually be for us to wrangle that, because it's not, that's a substantial amount of work amid all the other fires we're trying to put out. So it's a bit of prioritization.
Thank you, Eli. And I realize that we are almost at time. Amazingly and not surprisingly, we went through this hour very quickly. So I'm going to end our webinar with some closing remarks. Firstly, I just want to call out the criticality of data. I mean, data is so critically important, and thank you so much, Eli, for coming into the family of those of us who care about early childhood and childcare needs, particularly during this pandemic. So thank you so very much for entering in and being so gracious with the time and the questions moving forward. And Walter, as always, thank you for the work and the ability to be able to advocate a few blocks away to bring somebody else on to answer the really, really critical questions you are so familiar and expert around, and continuing to work with us to try and figure out how we can be as supportive as possible with the information needed so our communities can make the plans and raise up their voices in ways that'll make a difference for children and families and for all of us. So thank you so much, both of you. I also wanted to raise up that it is very obvious through the course of this webinar that we're all working very hard to provide the information that's needed, the data that's needed, and that, to Walter's point of earlier, it's unique to be introduced to a tool as the developers are also having a conversation about how to further refine and develop the tool. And your comments as an audience is incredibly important as we continue to move forward about what really is going to make the difference in information that you need to do the work that you need to do in your community. So I look forward to hearing more from all of you about your questions and your concerns. So as we rise to face this unprecedented public health and childcare challenge, Childcare Aware of America is of course committed to ensuring the childcare industry is supported in whatever ways that might look like, supporting families, providers, businesses, and policies and decision makers that are seeking answers and seeking ways to support the individuals in their communities during such uncertain times as these. Following this meeting, you will receive a link to explore the tool we shared today so that you yourself can be an Eli and get on there and explore and look at the tool and the data. And all of the resources as well will be in that communication to you that I mentioned at the outset of the webcast. We do invite you to explore our ever-growing hub of COVID-19 resources and share them in your networks, please. Forward those along. Please visit it often because we do update it often. And again, as I share probably every day, a new set of resources or a new set of data is shared. So please do visit it often and help us ensure our communities receive the childcare support that they need. A final word of thank you to all of you for all of the work that you're doing during this time. And please know that you can reach out to us. Thank you again to our panelists. I'm sure we will hear from you again very, very soon. Thank you all for joining us and have a great afternoon.